We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
If you can help to make things a little bit better, that's a good way to spend your time.
Good morning, everyone. It is my great pleasure to welcome you all to the Center for Global Development for this important event on the future of the President's Emergency Plan for AIDS Relief, better known as PEPFAR. My name is Victoria Fan, and I'm a senior fellow here at the center. Today, we have the distinct honor of welcoming Ambassador John Nkengasong, who has been at the helm of PEPFAR for nearly a year. Marking its 20th anniversary this year, PEPFAR has been a beacon of hope in the fight against HIV/AIDS. Over the last 2 decades, PEPFAR has extended life-saving treatment, care, and support to millions of individuals affected by this devastating disease. And it has enabled remarkable progress in reducing new HIV infections, preventing mother-to-child transmission, and expanding access to ART. While it's still early days in the long arc of history, PEPFAR may turn out to be one of the most successful global health programs in U.S. history. The ambassador needs no introductions. His accomplishments are many. As just one example, he served as the inaugural director of the Africa CDC and helped to secure something like 400 million doses of COVID-19 vaccines at the height of vaccine scarcity. So we're very honored to welcome the ambassador to the center for a conversation with CGD's Global Health Policy Director, Javier Guzman, on the future of PEPFAR, especially in these times of dire macroeconomic and fiscal constraints, inflation, debt, and many other pressing policy challenges. As an independent, nonpartisan think tank, CGD generates innovative economic research designed to inform better policy and practice that will help reduce global poverty and improve lives. CGD has published commentary and analysis on PEPFAR since its early days, from research examining the value for money of AIDS investments, the role of PEPFAR contractors, and the central importance of PEPFAR in U.S. global health policy. And we've continued to track PEPFAR amid these discussions of future financing and also proposed organizational changes in the State Department amidst a fragmented U.S. global health aid architecture. So we're so delighted to have the ambassador here with us as he charts a course for the United States in this global fight against HIV and global health security. So please join me in welcoming Ambassador Nkengasong.
Ambassador Nkengasong, it is a pleasure to have you here. Welcome to the Center for Global Development. As Victoria said, we are extremely pleased to have you here. And let's get started with, the very important topic that, we need to discuss when we talk about PEPFAR, which is reauthorization. It is a momentous time. We've heard about, the successes of PEPFAR, but people are asking about, is it certain that the PEPFAR program will be reauthorized? Can you give us your views on how you see it? This is a prerequisite for any conversation on sustainability, and we've heard, we've received questions about, a letter from, a representative in Congress who was supportive of PEPFAR before. We've heard about, some conversations that are not really accurate. So do you want to tell us a bit about how you see the reauthorization process and what should all expect from that?
Thank you. Thank you so much. Let me start by thanking the Center for inviting me to be part of this very important dialogue. I've been hoping that the Center will invite me. And immediately I saw the invitation, I grabbed it. So thank you for the opportunity. Let me also recognize the many PEPFAR parents that have enabled PEPFAR to achieve the results that you just alluded to and the impact of what it has done. I think I feel very privileged to be sitting here as the PEPFAR coordinator at a time where we are celebrating the 20th anniversary of PEPFAR. I stand on the shoulders of the previous coordinators that, you know, they have been here, I'm sure, Ambassador Burks, Ambassador Guzman, and Daibo, and because the impact that we are celebrating are the results of their very hard work and leadership. I see the room and I see many colleagues and friends from ESGAC sitting right here, from UNAIDS. Charles Holm is hiding there. He's putting his head down so that I can actually recognize him, but Charles cannot. He was part of the people that led PEPFAR during the time of, I think, Eric Guzman. So thanks, Charles, for coming. So let me lead with hope that PEPFAR has been reauthorized several times. And PEPFAR is one of the most beloved bipartisan programs that I'm aware of. And I've always said that good politics plus good public health practice leads to impact, good outcomes, and PEPFAR is an illustration of that. The lessons that PEPFAR have taught us, i.e. the good politics, or good implementation and good outcome, should be taught in schools of public health for generations and generations to come. It has saved 25 million lives, prevent 5.5 million children from being infected, about more than 20 million individuals, men, women, children, excuse me, receiving life-saving treatment. That is huge. So I really believe that PEPFAR is perhaps, just perhaps, the greatest act of humanity in terms of global health outcomes that the world has witnessed in the last 100 years, without no doubt. The pandemic that we had in 1918, the Spanish flu, ended without us truly knowing what the virus was. We didn't have the tools. When I mean we, I mean our four parents, and didn't have the tools. Today, we are very blessed to have strong leadership that has saved lives. What else can be more important in humanity for anyone to be part of other than saving lives and saving millions of lives? I want us to think of, when you think of PEPFAR reauthorization, to also think of 20 years ago, the ugly face of HIV/AIDS. For those who were around 20 years ago and saw the ugly face of HIV/AIDS in sub-Saharan Africa, life expectancy had crashed in many countries, decreased to about 35 years in countries like Zimbabwe, about 12 years in South Africa. The coffin industry was thriving in many sub-Saharan African countries. People that were adults were carried like babies, were a skeleton with a little skin over their bones, and these are people, loved ones. So I would just end by saying that PEPFAR is hope. PEPFAR reflects our values, our American values, that people, especially in Africa, recognize. When I left Addis Ababa in my previous job as the head of the Africa CDC, several ambassadors came to me and said, Dr. John, as they call me over there, we know what PEPFAR is. It's American people to the African people. And that is very powerful. We cannot let that slip. It's extremely important what we've done in terms of the expressions of our values.
Okay, well, thank you very much. And as we think about the future of PEPFAR, I mean, we go back to the strategy, the 5-year strategy that was published last year. And there was one pillar that is sustainability.
Yeah.
And sustainability, the strategy talks, and I've heard you talking about the importance of political, programmatic, and financial sustainability. How do you see that sustainability playing out now when there are so many competing priorities. We heard about the fiscal crisis. We're talking about backsliding on democratic values, even discrimination laws. What was the angle to get to these three elements that you mentioned in your strategy?
I think the three elements are very related. We should always lead the conversation by what is the problem we intend to solve. The problem we intend to solve is that as we speak today, thanks to PEPFAR, over 20 million people are receiving life-saving treatment. And the fact is that if we do not support these programs, we, the collective we, the countries, the partners, UNAIDS, Global Fund, PEPFAR, such that people get up in the morning and get their one tablet a day, within less than 4 weeks, the virus will rebound, which means there will be transmission and people will die. That is, we can easily go back to where we were 20 years ago in the twinkle of an eye if we are not careful. I think this is, so just keep that in mind. The second thing is that we've made remarkable progress, but there's still a lot of work to be done. The rates of new infections, yes, they've decreased over the years, but last year alone, UNAIDS told us that about 1.5 million new cases of infections occurred. There were about 650 deaths in the world, of which 425,000 were in Africa. So we are not out of the woods yet. We've made progress, let's admit that. So sustainability has to be a dialogue, a conversation that we must have now and say, if we are all committed to getting to 2030, which is the SDG goals, the Sustainable Development Goals that we have, I will agree, then assuming we come to 2030 and HIV/AIDS is no longer a public health threat, which means we've decreased the number of new cases significantly, what will happen? In 2030, you still get millions of people that wake up in the morning looking or desiring to take that one drug and live a healthy life. That we still need to do a viral load test to make sure the viremia is suppressed, right? So we have to ask ourselves the question, how do we sustain that large number of people and integrate them into our healthcare systems? How do we prevent those young people? Because the infections now, especially in some countries in Africa, is occurring a lot in adolescent girls and young women. How do we make sure that we cut up that tap of new infections? So political sustainability is important. We don't want to be the victims of our success. We don't want to be vulnerable to our own success, where the political leadership is not seeing HIV as a threat anymore. And that is dangerous because it's all driven from the political leadership, right? I started off this conversation by saying good politics plus good public health leads to impact. So we need to always remind the politicians that the political leadership that HIV/AIDS is still a pandemic, is still a serious security and developmental issue. So that is one. To support that, in February, I was at the African Union Summit. I asked the head of states to give me a speaking slot. I presented to them 33 head of states what PEPFAR has done in 20 years. It was the first time PEPFAR was presented to a large collection of head of states. And I asked for their recommitment. I said, in 2001 in Abuja, you all met and committed to the Abuja Declaration. It is time for you 20 years down the road to regroup and evaluate that commitment and recommit so that we all walk the journey to 2030. That is part of the political commitment. Financial commitment, in some countries, you like South Africa, Botswana, Namibia, you see countries investing a lot of their own resources. And in some countries, in excess of 70 to 80% of the HIV funding is from national resources. We want to see more and more of that. But in some countries, on the other end, you have very limited government engagement. It's mainly driven by donors. We really want to sit down and have a dialogue and have a sustainability framework that says We understand where you are as a country, but to get to 2030, these are the things that we must do together. Programmatic sustainability. We've developed a lot of partners, local partners there. How do we sustain and maintain them so that they can continue to lead the response together with the governments, what we call the G2G, government-to-government partnerships there. If we do those three things, I think that is what will define sustainability, which in sum is essentially joint accountability and joint responsibility.
Thank you. You mentioned something very important. Sustainability is closely related to partner countries and closely related to their involvement. And we've heard, and we've seen the target of localizing, and 70%, and PEPFAR is, ahead in that conversation. Do you see a change in moving more into the government to government? I know primarily the localization has been with NGOs, but how can we, or how is PEPFAR thinking about engaging much more with governments?
PEPFAR is thinking across the board. The non-governmental organizations, in my view, is not the only part towards strengthening local capacity. Government capacity must be strengthened and directly and build relationships there. And there are examples, right? Rwanda. In Rwanda, I believe Eswatini and other countries, Namibia, there's a lot of strong government-to-government engagement there. But we need to build make sure that there's appropriate accountability, governance systems in place, which countries are not opposed to that. It's just we have to be very intentional in saying, look, government, the NGOs, the faith-based organizations should all come together and be part of this localization agenda. So it cannot be either or. It should be all of them together.
Yeah, I guess the hard part is to, as you said, create the governance structures and all the processes with the governments. We've done some work here at the center, not just showing how that government-to-government part is not growing very much, but also some ideas on how you engage with governments. Anyway, we'll send all that to you. But shifting gears a bit, if you think about donors, and we think about collaborating with other sources of funds and partnering, is there any thinking about engaging new sources of finance like MDBs, like development banks? There's a lot of conversation about pandemics and new sources of funding there. Is there any plan on that? How to do that?
Absolutely, it's part of our strategy. When I came in, we took a hard look at who are the partners that we have. And we recognize that partnership is an evolving concept. The kind of partnership that you have today to address an issue is not the same partners that you need in 5 years. Because if that partnership is effective, you would have addressed that issue and you move on. So what are some of the challenges that we have today? I think first is that PEPFAR has been flat funded for many years, about 10 years. The fiscal space is narrow and narrowing every day, especially with COVID in countries that we support. But there's a desire out there, especially having seen what COVID did across the world, especially in developing countries, where the development banks, i.e. in Africa, for example, the Afri-Exim Bank, the African Development Bank, I think they put out they've manifested that they are ready to deploy over $3 billion in supporting health systems, including manufacturing. The question now is the convening, and how do you sit down around the table and say, look, as a vertical program, these are the things that we are doing in country X, and how do we sit down with a bank like ADB, just an example, a regional bank, development bank, and see where our resources all come together, such that if they are strengthening hospital innovations or public health systems, like surveillance systems, we make sure that they align with those vertical diseases, i.e. TB, malaria, and tuberculosis. Those are the kind of dialogues that we are beginning to have. so that we come around the table. Foundations. Foundations, of course, the Gates Foundation has been a leader in this space, but we want to bring in new partners, like the MasterCard Foundation, where they saw clearly during the COVID pandemic that you cannot only focus your attention on economic development, that a disease outbreak is a serious health threat, it's a serious economic threat, and it's a serious developmental threat. We need to have all of those partners, and we have a very good COP season, the country operational plan season in South Africa, where we brought all of these partners together to begin to have that dialogue, and it's continuing as we speak.
Yeah, no, well, we know how successful you were when you were at the Africa CDC at getting new sources of financing and engaging, for instance, the MasterCard Foundation. So I'm sure you'll have a good entry point there. You mentioned manufacturing, and of course we talked about partner countries. A lot of interest in Africa and a lot of interest in the world about diversifying manufacturing and learning the lessons from the pandemic. And we've seen how PEPFAR has made important commitments in terms of the short term, the diagnostics by 2025 and 2 million clients by 2030. Do you think that's realistic? And what are the prerequisites, or what are the things that we need to be in place for this to work? It's a hard, nut to crack. So no, what's your view?
No, absolutely. It's hard, but that is why we should address the problem. Because it's diversifying, and I like the word diversifying manufacturing, because when people say regional manufacturing, is almost like you're doing that only in the regions. Is diversifying it, is decentralizing it for our own global health security imperative, our collective global health security imperative. Everyone in this room have said it's a question of time before we have a new pandemic. And we just don't know what the new pandemic will look like. As a virologist, I always paint a picture of SARS-CoV-1 that occurred in 2002, and it had a very high case fatality rate, about 15%. 20 years down the road, SARS-CoV-2 emerged and had a case fatality rate of 3%, but spread very, very quickly. SARS-CoV-1 didn't spread that fast, so it was a pandemic, but very restricted pandemic. And the great fortune we had 20 years ago was that it was only spread when people had symptoms. SARS-CoV-2 spread when people were asymptomatic and sick as well. Now, if we project and you model SARS-CoV-3, okay, because as a virologist, I think the next challenge will still be a coronavirus, which has the emergence of the two properties. Then we'll not have time for trickle-down access to diagnostics, trickle-down access to medication or vaccines. If we do that, within 1 year or 2 years, about 10 to 15% of the world's population will be gone. And this is not exaggeration. In 1918, in 2 years, 20% of the world's population was gone. And you can argue that technology today is better than that, because within 1 year, we were able to identify a new virus, create vaccines, and started immunization. But if we do not do that in a decentralized way, there is no way you can protect any part of the world having access to diagnostics and vaccines, and another part of the world not having that. You just continue to have a recycling of the threat. Now, is it easy? Well, it's not easy, but if we approach it from a security lens says that diversifying manufacturing should be seen as an insurance policy and not a return on investment. We tend to pivot towards a return on investment, where if we manufacture, how are we going to get our price point right? And it cannot be that. It has to be for our own safety and security. Given what I just outlined earlier, if we do not decentralize, what will happen to our own security? What will happen to that other disease X when it finally emerges and we are scrambling to protect ourselves? Look, common sense dictates that when there's a new disease and people are dying, you protect your people first. That is common sense, okay, approach. It's political. Okay, and at that point, it's not logic to say I have to, first of all, go help my neighbor before I help myself. But we do not come out from such a threat if we do not do it collectively. That is why diversifying manufacturing is important. Why is PEPFAR in this? We believe that for 40 years we've been doing HIV testing in the world, but there are certain parts of the world that not a single rapid test, HIV rapid test, is manufactured in. And that is a security threat. It's not just promoting HIV manufacturing, but it's laying a foundation on which you can develop other diagnostics. We have to start somewhere. It's laying a foundation where you can develop other treatments so that we are truly in the space of close cooperation, coordination, collaboration when a new pandemic hits.
So clearly we see how the challenge is not just HIV/AIDS, and the challenge is how you leverage those investments for other purposes. Of course, you mentioned pandemic preparedness, but you could also talk about health systems. And if we talk about that leveraging, well, we talked about manufacturing, but what about human resources? What about integration? What other entry points you see as ripe for moving forward and progressing for those other objectives?
Absolutely. You started outlining some. When you take some of those areas, if you take HIV and then you align it side by side COVID-19, and you say, what are the tools that are common across these two diseases there? With the exception of vaccines that are available for COVID and not for HIV, you need the same systems. I mean, you need good human resource capabilities. You need good labs, laboratory systems and networks. You need trained human resources at different levels, especially nurses, doctors, community healthcare workers are very, very important. You need good data system. You need good supply chain. So if you just line these things, I mean, about 6 of them, and you triangulate them with any disease, they are the same system that we should be focusing on. And we've seen the power of leveraging, where whether you're dealing with COVID or Ebola in Africa, PEPFAR platforms that have been in place have been used extensively during those crises to expand the delivery of those commodities, i.e. infection prevention, control, diagnostics, vaccines. So it tells you that if we are more intentional in what we are doing in terms of preparing for the next pandemic or the next health security, we should invest in those horizontal systems as well. Be more intentional in investing in them.
And is there any entry point or way to do it, or is it working on the 6th at the same time?
It's working with it by building partnerships, because PEPFAR, as you know, is a law. It has a law behind it, and it says, Mr. Ambassador, your role is to make sure that we bring HIV/AIDS to an end. So focus on HIV. Yes, those systems are developed in the context of HIV, but it also allows room for partnerships for us to sit down with the World Bank, the regional development banks, the foundations, and look at the entire spectrum, the entire ecosystem, right? A partnership of that nature is the Go Further with the Bush Institute, where we are interested in doing, and UNAIDS is also a partner with that, and others may be here at Roche and others. So you bring several partners that can extend what you are doing. So the HIV platforms or PEPFAR platforms are used in screening, but others come in and help with the treatment. Okay, that is the way we should be creating these partnerships, so that you're looking at you put a patient or the person at the center, okay, and you provide comprehensive care around that individual.
Okay. Well, let me ask you the final question before we turn to our audience. Well, thank you for coming, and we also have people online. And this final question is, when we read the strategy, the 5-year strategy, we see that, 2030 is the key milestone, when you plan to achieve this huge goal of having not having HIV/AIDS as a public health threat. So is that the plan? Is the plan that PEPFAR should go until 2030, and then after that it will just be embedded into the rest of the ecosystem, or is there a PEPFAR after 2030?
Let's take it step by step. I mean, we should all strive to, and I remain optimistic that PEPFAR is reauthorized for the next 5 years. I think I was very privileged to spend 3 days in South Africa with 6 senators as part of the CODER visit. And I can tell you that they were visibly impressed by what they saw in terms of the impact of PEPFAR in South Africa. And I think they also went to Zambia. When they came back, that energy, that momentum led to the hearing that the call on April 19. So let's continue to make sure that we use all the leverages that we have to engage with our political leadership so that PEPFAR is reauthorized in the next 5 years in a timely fashion. If PEPFAR is reauthorized in the next 5 years, it takes us to very close to 2030. At that time, we'll see where we are in the AIDS response, and I'm sure that it will lend itself automatically to another reauthorization, because success has many parents and breeds success. The reason I started my response by citing the experience in South Africa is that the senators were there. We sat down over breakfast, and I remember one of them grabbing my hand and said, "Doc, we can get this thing done by 2030. Just because the day before we had been in the field and field sites to see patients. We saw a family where the woman was HIV positive, the man was HIV negative, knew that the woman was HIV negative, positive, but had viral load that was undetectable. They decided to get married and had 3 beautiful children, and all 3 children were HIV negative. That is the power of PEPFAR right there. And when they saw this, they could touch it. It was more than data. It was more than putting a series of senators in a room and say, this slide shows you the decline in incident rate. I mean, they don't, but seeing that was that data. It was the evidence that they could touch it, they could feel it. I remember one of them saying, we need to invite this couple to come to Washington and testify. Just that's the power of what, by seeing it, the success. So the point I'm making is, let's take it step by step, get the PEPFAR reauthorized for the next 5 years. You see remarkable impact. So many countries will have been achieving that success story, and then we'll see where we are going to 2030.
For sure. Okay, well, now we are happy to take questions from the audience. Please raise your hand. We'll get you a mic. And when you get the mic, please introduce yourself and ask the question to Ambassador Nkengasong. We also have, if you are online, please send us your questions, and we can then ask them here. Oh, we've got a shy audience. Oh, please.
Thank you. Thanks, Ambassador Nkengasong. Really, really appreciate both your leadership and being here today. Colin Puzo-Smith with Results. I loved what you were saying about the role that existing systems for HIV PEPFAR programs played in the COVID response, need to play in future pandemics. And I was thinking back to the first point you made about the need for political alignment with public health implementation. And it feels like the public health side of it is there, but that politically there seems to be a gap in understanding and sort of making a false choice between current pandemics and future pandemics. And so I really value your insight on how we can be better making the case politically to integrate investment systems, the approach to make sure that we're not leaving behind the current pandemics in the sort of push to look to the future. Thanks so much.
You want to take a few, or you want to answer that one?
Let me maybe take that. With age, I tend to not remember many things at the same time. It's just, so I think we should adopt what the concept of sustained political engagement. And sustained political engagement is, which says your interaction with the political leadership should not be an event, but it should be a process. It so happened in February that we inadvertently saw that in action. So I flew to the African Union. They had the AU summit, all head of states in Addis Ababa, presented to 33 head of states, secured their commitment through a declaration that they will host a special summit on HIV/AIDS in Africa by the end of by 2024. So that was unprecedented. Then I flew from there to South Africa and met with 6 senators. It was not designed that way, but it so happened that way. So when the 6 senators were all traveling there, I showed them the declaration. I said, look, I just came back from Addis Ababa, and the head of states have said, we are going to have a special summit in Africa to recommit ourselves, and more importantly, to design a roadmap to 2030. So they are committed. They are not leaving you alone. They were super excited. That's what I call sustained engagement. But we should take that further, where we actively engage the here and continue to engage with and show them evidence of what is happening. Find ways that the staffers, the hearers, and we all know what the impact looks like, and paint a picture of true impact. I think that's the only way. And when I look at the political leadership, especially in my previous life at the African Union, sitting there for close to 6 years, is exactly that, what I did with at all levels, with the foreign ministers, with the ambassadors that were present there all the time. I would go actively look for space to brief, to do the briefings, and seize any opportunity to do the briefings there, and keep it sweet, short, and to the point. And they got it. Before I left, I mean, everybody could tell you what health security was, at least most ambassadors there. So is that sustained political engagement that we need to remind ourselves all the time?
You wanted to ask a question, please.
Good morning, and my name is Vinay Saldan. I'm the director of the UNAIDS Liaison Office here in Washington, D.C., and a short comment on behalf of UNAIDS and on behalf of the UN system, and then a specific question to Ambassador Nkengasong. First of all, there has been a lot of amazing, impressive data showing not only what PEPFAR achieves, but from a United Nations Sustainable Development point of view, we saw across the range of health and development outcomes how almost all of these outcomes actually took a huge step backwards during the COVID pandemic. And the many health and development partners, including in the United Nations, are now regrouping to find out how to get these outcomes back on track to reach the 2030 goals. We didn't see that in HIV. In HIV, perhaps at certain points, the rate of progress slowed down a little bit, understandably because of COVID, but overall, the progress on HIV remained strong. And where did it remain strongest? In the countries where PEPFAR is partnering with national governments and communities to move things forward. So from a UNAIDS point of view, the value added of the PEPFAR contributions to keep the global HIV response and national HIV responses on track despite challenges from pandemics like COVID and what might be around the corner is absolutely unquestionable. Building on that, specifically to Ambassador Nkengasong, if you could talk a little bit more about the amazing work that you and your team are doing in working with partners and countries on conceptualizing what could sustainability roadmaps look like moving forward. And I'm saying this because we had the pleasure of working with you and our executive director, Winnie Byanyima, during the IMF World Bank spring meetings, and it was really an unprecedented meeting since before COVID to convene 12 ministers of finance, not ministers of health, but ministers of finance from sub-Saharan Africa, on a sustained dialogue on what does financial sustainability and national ownership look like moving forward in the HIV response. I fully agree with the ambassador that political commitment at the level of heads of state are critical, but a key piece of national leadership is engaging the financial leaders through ministers and ministers of finance in a dialogue on what does a sustainability roadmap look like to build towards sustainable financial and national leadership on HIV.
Absolutely. I think, let me comment on your comment, then I can comment on my own, the question you addressed to me. I think there's no doubt that for the past 25 years, HIV has reshaped global health in a massive way. Investments from Global Fund, from PEPFAR, the formation of UNAIDS, have all shaped global health. But it is my thesis today that other outbreaks will now begin to define HIV/AIDS. I say that because when you go to, and this brings us to the sustainability question, when you get to the state houses or the presidencies and to have a discussion on health, the discussion doesn't start with HIV/AIDS, it starts with a security threat. It's either a COVID threat, an Ebola threat, or a massive cholera outbreak. So we have to be very, very conscious of the fact that, as I said earlier, that the progress that you just outlined for HIV has inadvertently lowered the visibility of HIV in the radar screen, in the competing radar screen of the political leadership. So we should continue to find a way to reframe that and bring it back to that leadership at all the time, so that the political leadership do not see other diseases, what I call the disruptive outbreaks or pandemics, and ignore that HIV/AIDS is still a serious pandemic. So in terms of the sustainability roadmap, there are several components of that, which I hope that Mike is, and Mike can speak to that as well. Just a few days ago, on Monday, we had a first meeting, where a consultative meeting, and I was surprised, positively surprised, that over 1,000 people signed into that dialogue, included partner countries, donors, foundations, and the civil society, faith-based organizations. It was designed to start a dialogue, so that it's a conversation that brings in UNAIDS, the Global Fund, civil society, and faith-based, and everybody, so that we all co-create a pathway for sustainability, what it means, and have common definitions. That when you use the word sustainability, it's not about handing over to you and running away, or PEPFAR is going to stop. When I just took this, came on board, and we had the IAS meeting in Montreal, I met with about 10 ministers. And each time we sat down, what was on their mind, it was, are you going to stop PEPFAR? No matter what I said, what was on their mind was, tell me again the sustainability, what is. So we took time to, so for sustainability, we need to message frequently, and we need to message early what it is. And that's what I hope that dialogue that we had resorted to, that what is sustainability and what is it not? That we are committed to the end, and we are committed past 2030, which means there will be millions of people that are still receiving treatment, and they deserve quality life to the end of a lifespan. And somebody needs to take care of that. It doesn't necessarily mean PEPFAR will continue to do that. It means that if we have that dialogue, countries can prepare to take their part, their responsibility. That's why I'm framing the dialogue around sustainability as shared responsibility, but shared accountability as well.
I guess importantly is a process, as you said, and the transition needs to be planned and needs to be managed, and the partner countries will need to know that there will be, that PEPFAR will be with them along the way. Yeah. So sustainability, as you said, is not just dropping the ball. Yeah.
I'll hasten to also add that countries are seeing this, some countries are seeing this with pride. I was in Kenya in January and sat down with, on a Sunday afternoon with President Ruto, and with the US ambassador in Kenya, a great ambassador, and he said, and we painted a picture and journey to 2030. He turned to his permanent secretary, who was sitting next to him, and said, Mr. Permanent Secretary, I want this done by 2027 with us. And said, if they support us a little bit more, we can do it ourselves and bring this to an end by 2000. So countries are seeing this as, if we have the right dialogue, countries begin to see this as a source of pride of taking care of their own people. I think we should promote that. That's
so source of pride and responsibility and delivering to their own people. Any more questions from the audience? Yes, please.
Thank you very much, sir, and we really appreciate all of the insights you've provided. Still speaking on sustainability, I just wanted to know what PEPFAR's focus is regarding integration. Now, integration, I know we've talked a lot around integration with the public health system, the primary healthcare system. So we're looking at integration in a different way, in terms of, understanding that HIV is a chronic illness, and in the course of the infection, you have comorbidities, right? So how about integration in terms of disease-specific integration? So we're seeing a lot of our HIV patients die from hypertension, complications, having mental health issues. So how intentional is PEPFAR, going forward in terms of integrating our programs? I know that's happening in, small pockets across the regions, but how can we get to that point where we're more intentional around integrating chronic disease programs into, existing HIV programs? So that way it ties into what you mentioned about looking at that patient as a whole and not just, a HIV patient. So that's some of the clarifications I wanted. Thanks.
I think in that space is beginning to crystallize, where we are saying, let's always remind ourselves with what the objective and the goal of the PEPFAR is. What is the law that governs PEPFAR? The law says go out there and do three things with HIV: prevent HIV, treat HIV, and care for people affected with HIV. That is, when I mean OVCs and all. So that's the law. We always have to look at the law. What does it tell us? Now, we are approaching integration from the lens of, if countries have made progress and they have reached the UN goals of the 395s or exceeded that, and they are at a point where they are struggling to find the 5% patients that are still missing without knowing their status, or 2% of patients that need to finally receive their treatment, where do you find them? So that's where the conversation of integration becomes very interesting, where you say, well, I just can't set up standalone settings because I will not find the yield. The yield will be very limited because I've already brought in about 97% of the people that are HIV positive know their status. Where is the 3%? Maybe, and just maybe, and nobody knows, we'll see in this COP season, several countries included integration models into that, and we let that go, especially countries that have exceeded the 395s. We say, just maybe, if you now go to a clinic that is offering services for hypertension, diabetes, and others, the NCD clinics, maybe you offer a test as well. You say, well, why checking your blood pressure or taking your meds? I mean, we would offer you an HIV test, and you can find that. I think that's an area that we are looking at. Countries offer several models, and in the COP, we'll see by the end of the COP period, which goes now to 2025, we'll learn a lot more on what to do. But again, the short answer to that is that as countries move towards the 395s, we have eased some of the earmarks to allow them to use the integration as a tool to find more patients that they can bring into care, and bring them to care to maintain their viral load in a suppressed manner.
We had another question here. Thank you.
Thanks so much. Thank you, CGD, for hosting the event, and Ambassador Nkengasong for making the time for this timely discussion. I'm Kiki Kalkstein with Global Health Council, and I had a broader question. Mid-last year and toward the end of last year, we were hearing more about the potential reorganization within State Department, including PEPFAR and some of the global health security work, and just wondering if there is more you can share about progress there or timeline and what that looks like and kind of the vision for that as you also are talking about executing on the 5-year strategy for PEPFAR. Thanks.
So that I'm pleased to let you know that the Secretary Blinken in December notified Congress that of his intention to create a bureau of global health security and diplomacy within the State Department that will bring in PEPFAR and health security in one bureau. I'm also pleased to say that it looks like just last week and between last week and this week that the final holds that we had on that CN, congressional notification, have been lifted or are in the process of being lifted. When that is done, it is my hope that by the end of this summer, the Bureau will be launched. I think that is all good. It's taking a little bit more time that I would have loved to see. What is that? What does that do for us? I think it provides, in the Secretary's vision, I think he's made global health security and diplomacy one of the 7 priorities. And you begin to integrate global health security and diplomacy into our foreign policy, which is a great thing. As the Secretary has said, health security is national security. And we've seen what COVID has done, not just in terms of life loss, the 20 million people that have died because of COVID and from COVID, but the disruption, the economic impact that it has had. About $15 trillion have gone into this, including economic packages. So I think there's a full awareness and recognition that having an office within the State Department or a bureau within the State Department that helps us provide leveraging or making us lead with diplomacy, help with coordination of our own efforts and assets across the board will be a very positive thing for our country.
Definitely, and I guess the question there is, HIV/AIDS and PEPFAR have led the way in terms of how the U.S. government has managed the bilateral support for the vertical diseases. Is there any news or any plans to also look at, malaria, PMI, maternal and child health, incorporate elements like that in this conversation?
You mean in the conversations with
in the conversation about foreign policy and about learning from the lessons that PEPFAR has basically spearhead?
Yeah, I think the PMI, which is, I call it the sister program to the President's Malaria Initiative, it's a sister program to PEPFAR. And the underpinning is the same, which is part of our humanitarian assistance and, of course, diplomacy in the countries that we operate. So, but the vision that the Secretary is putting forward is broader than that. It's really enabling it to have a platform for better coordination, cooperation across the world, like what he did during the COVID outbreak. There were several foreign ministerial forums where they used that in advancing the coordination efforts of around COVID-19. Remember that vaccines were distributed through the systems that were set up at State Department. Distributed to our partner countries through that system. That's the kind of benefit that such a coordinated approach within the State Department can bring to all of us.
Definitely. Any final question? Please.
Hi, thank you, Ambassador. I wanted to refocus the conversation back to the African continent. My name's Tisha Wheeler, and I'm with Roche, but I was with PEPFAR for many, many years. And so we had a conversation with the Africa Union representatives, the Africa Union Development Organization, the AMA, the African CDC last week. And as private sector, they have a very tactical way of engaging private sector, talking about investment and engaging also regional development banks and a vision for, creating regulation on the continent, manufacturing on the continent. And I found it to be just an incredible meeting where I thought, this is the future of Africa. And they had an idea of how PEPFAR could fit into that. And I'd love to hear your thoughts on this, because I walked away thinking, wow, I've worked 20 years on HIV in Africa, and today I really feel it's a time for change. And what PEPFAR can do is, this is a moment where we really have to move in the right direction of sustainability.
So let me just excuse me. Let me just echo what you said. This is the moment to lead in a different direction. And and we are leading in that direction. We invited the AU for the first time, excuse me. In February, we invited the AU for the first time to attend the COP planning meeting. We also invited the African, the Africa CDC to join the meeting in Johannesburg. The purpose of that was to say, look, we are on a continent, and the disease we are fighting is to support your national governments to lead. And you are the central body that coordinates all countries on the continent. So what can we do together, jointly? And it is through such consultations that we will co-create a sustainability roadmap. A sustainability roadmap that is not seen like it's a PEPFAR-driven exercise or UNAIDS, but it's something that everybody had a stake in it, and everybody had an input, an intellectual input into it. So you're right, it's a new day with engagement with the African Union, and they are very pleased with that. Several of their commissioners have called, and they're very excited with the prospects of us working with UNAIDS and the Global Fund to support the special summit on HIV/AIDS. I think I have no doubt that there will be a lot of ownership once that is done of the instruments that will emerge from such consultations.
Well, any final burning question, or can I just thank Ambassador Nkengasong for being here, thank our audience for being here, thank the people online for joining us. I think it's been a wonderful conversation. I take away, the way you ended in terms of this is the moment, and the way you started in terms of the reauthorization is the first step, and the need to align, the political, financial, and programmatic elements to really have sustainability. So I wish you all the best with the reauthorization, but also with these big challenges and big plans that are included in the strategy. And we here at CGD will be producing content and helping in the way we can to provide evidence for these decisions to be made. So please join me in a round of applause to our guest, Ambassador Nkengasong.
Thank you.
Thank you very much.